Hi there, my name is Tammy LeClaire. I'm going to be your nurse today. How are you? Okay, so I would like to check your identity. Can you tell me your name and your birthday, please? Okay, great, thank you. And so Susie, I understand that you haven't had a bowel movement in a couple days, is that correct? How long has it been? 4 days, okay. So is that normal for you? How often are you usually having a bowel movement? Okay, so it's not unusual for you, right? Okay. So at some point we need to maybe talk to you a little bit about maybe adding some fruit and vegetables to your diet, a little bit of extra fiber, maybe increase your fluid intake. What do you think of that? Right, okay. So let's talk about that a little bit more. Maybe we can even bring the dietitian in. That will really help you get a little bit more regular. Like to see so that you didn't have to rely on laxatives to go to the bathroom. Yeah, the other thing that we can do is get you up and going, and I know with your arthritis that's difficult, but I would like to maybe get physio in here and see if there's something we can do as far as getting you a little bit more mobile so we can get those bowels moving a little bit more naturally. Does that sound okay? Okay, excellent. So I'm going to wash my hands and I'm going to come back and do a little assessment on you before I can give you your bowel care. Does that sound okay? Okay, just going to step over to the sink here. Okay, so Susie, I'm just going to raise your bed up a little bit here. How have you been? How's everything been here while you've been here? Yeah, you don't have any concerns or anything? Do you have any pain at all, Susie? Do you have any pain anywhere in your body? Okay. Any discomfort? No? Okay. Okay, so Susie, can you tell me where you are right now? Right, you're at NIC, that's correct. And can you tell me what day it is? Yeah, and time? Excellent. So I'm talking to Susie right now, and I can see that she's got a great airway. She's got no problem breathing. Her skin is a good color, and I know that she's alert and oriented ×3. So we're good to move on. So I'm going to go ahead and do a abdominal assessment on you, Susie, if that's okay with you. Okay, excellent. So what I'm looking for here in the abdomen is any obvious deformities, any distension at all, any color disformity. I don't see anything visually. I'm going to palpate the 4 quadrants. I'm not feeling anything. No mass or anything like that. And Susie, are you having any pain or discomfort as I'm palpating these areas? And she states that she is not. Susie, do you have any nausea or vomiting? Have you had a lot of gas? Okay, and she states that she is not. So Susie, while I'm down here, I'm in the abdomen area. I'm going to also check your catheter if that's okay. So while doing catheter care and checking the catheter area for Susie, I'm going to ask her to position her legs upright, bent slightly, and just slightly spread apart like that. And I'll keep her shirt down here. And Susie, I'm just going to expose your peri area, if that's okay. Okay. So visually I can see that the catheter is intact, and I'm not seeing any sediment in the lines. I'm seeing a nice amber colored urine, and I'm seeing 150 mils in the catheter bag, which is adequate output for a patient, since I know that she has just had the catheter bag changed this morning, on shift change. So what I'm going to do now, Susie, is give you a little bit of peri-care down here. I will just go back and get my bowl, and I'll be right back. You can relax for a second while I go get it. Okay. You don't have any pain or discomfort at your catheter site, do you, Susie? Great. Okay, again, I'm just going to expose your peri area. Thank you. And you're in a good position for me to do the cleaning. So I'm going to take my cloth and my soapy water. My nice clean cloths that haven't been used over here. My soapy water, and I'm going to wash front to back. I'm going to go farthest away first and then move towards me. So I'm going to do your labia majora first, straight down, and then clean piece of the cloth, and do your labia majora on this side, the closest to me, straight down towards the rectum. Okay, and getting third corner of the cloth, opening up and doing labia minora, straight down, farthest away from me. And then the last corner of the cloth and doing labia minora, straight down. Excellent. Okay, so I want to put down a barrier here on the bed, and then I'll discard my cloth there. So another fresh cloth and the nice warm soapy water, and I'm going to clean around the catheter. It's going to be one movement around the catheter, and then I'll come straight down the catheter. So one movement straight around the catheter, and then straight down the catheter. There we go. Okay, so now I can dry the area. Nice dry cloth. Far away, and dry it up. Very good. Okay, nice and dry. So Susie, you can relax now. Excellent. And I am going to just check your hands, because I know that you have some eczema. And take a look at those hands and see how they're doing. Do you have any concerns about your eczema at all? It's not been too itchy? Okay. Okay, well I can see that it's not too red and the skin is intact, and that's what we want. We need to maintain that skin integrity, you know, to keep the keep it from getting infected. And again, on this hand, a little bit of redness, but really not bad. And you said the itchiness is not too bad, so we're not too bad for pruritus. That's excellent. All right, so I'm gonna go and get your medication, if that's all right with you. I will be right back with your meds. You have your call bell? Excellent. Okay. Okay, I'm headed over to my MAR now and my drug cart to get Susie Wong's medications. So I'm outside of her room at the drug cart. So looking at my MAR, I can see that my medications for Susie Wong for 8 o'clock are going to be hydrocortisone, 0.5%. And I see that for day 4 with no bowel movement, I'm to give her a sodium phosphate fleet enema. And so that's the drugs that I'm going to be taking out. So starting with the hydrocortisone, I'm looking in Susie Wong's drawer and I've got hydrocortisone. So that's this. So I'm going to compare this to my MAR. I've got Susie Wong and Susie Wong. And the drug is hydrocortisone, 0.5%. And I am, it's the right time, it's 8 o'clock. And the right date, yep, it's the 20th. Expiry is 2025, so that's all good. I'm giving this to Susie because she has some eczema on her hands, and so this is the drug that we're giving her for that. And it says here as well, apply to affected areas for eczema, twice a day. So I know that my order matches up with my drug and with the diagnosis. I'm putting this topically, that's the root, and I've already educated her a little bit about not allowing that skin to break down, and we've talked about that, but I will talk to her a little bit about not overusing hydrocortisone. And so now the other thing with hydrocortisone is I'm going to look at my drug card that I have here and tell you a couple things about the drug. So this is a corticosteroid. It's for the management of inflammation and pruritus, which she has. It's associated with inflammation and pruritus is associated with various allergic immunological skin problems, which is what she has. It will suppress the normal immune response and inflammation. Pharmacokinetics, so absorption is minimal, but we wouldn't want to cover it because that can increase the amount of absorption there is. And as long as we're just putting it on a small area, which we are, we're just putting a thin layer in a small area, so the absorption will be minimal. It's metabolized by the skin. It lasts about 8 to 12 hours. The onset is minutes. If she had any sensitivity to glucocorticoids or any of the vehicles that are in this medication, we wouldn't be administering it. However, she's had this medication regularly for quite some time, so we're not too concerned about that right now, but of course we would be assessing afterwards. If the patient had hepatic dysfunction, diabetes mellitus, cataracts, glaucoma, or TB, we also would not administer. Side effects can be allergic contact dermatitis, atrophy, burning, dryness, edema, folliculitis, hypersensitivity reactions, hypertrichosis, hypopigmentation, irritation, maceration, malaria, perioral dermatitis, secondary infection, and striae. It can cause adrenal suppression, so we watch for that. The drug interactions, there's none that are significant with a topical administration. And the root and dose is 1 to 4 times daily, and on her MAR we know that it's twice daily, so we're within range for that. Hydrocortisone nursing implications. We will assess the skin, which we've already done before the therapy, and note that degree of inflammation and pruritus, which we've asked about. And there can be, with this drug, lab for adrenal function, but there hasn't been an order for that. Implementation, we're applying sparingly as a thin film to clean, slightly moist skin, and then I would want to discard my gloves immediately and wash my hands afterwards. The patient has already been educated about this drug a little bit. I've asked her to not go near her eyes with her hands after it's been applied, and that we wouldn't cover it with a bandage, and not to scratch her skin because we wouldn't want to have it open for infection purposes. Afterwards, my evaluation would include checking the skin to see if the itchiness has gone down, the redness has gone down, and that she's tolerated the drug well. So that is the med card for hydrocortisone. So I'm going to do my second check now as I pour my drug into here, into the little dispenser cup. So as I pour it, I am looking again, Susie Wong and Susie Wong, and it's hydrocortisone, 0.5%, hydrocortisone 0.5%, that's correct. It's applied to the affected areas for eczema. So the root is topical, and it's for eczema, so that's the reason. And the time is for the 8 o'clock administration on the 20th, and the dose is just a light application topically. So I've already done some education around this, and I will evaluate after it has been administered. And of course, she has the right to refuse when I go in there. So putting this drug away now, I'm going to go through my final check. So my drug is hydrocortisone ointment, 0.5%. Matching it up with the order, hydrocortisone ointment, 0.5%. It's for Susie Wong. Susie Wong. Apply to affected areas for eczema. So the diagnosis is eczema, which we've seen, and that's for eczema, so that's our reason. Applying topically, and topically, 8 o'clock is the time, the date is the 20th, the expiry again is 2025, and education she's had about this already, and evaluation we'll do afterwards, as well as the documentation. But as far as goes right now, we do have the order for it, so that covers that part of the documentation. Okay, so we're ready to put away the eczema cream, and we're ready to dot the MAR because now this is poured, the hydrocortisone is poured. I'm dotting my MAR on the 20th at 8 o'clock. After I've administered the medication, I'm going to come back and sign it. So the next drug that I need to choose is the sodium phosphate fleet enema. So that's right here in her drug cart, sodium phosphate fleet enema. And this is for Susie Wong, and I've gotten it out of Susie Wong's cart. And Susie Wong, I have identified my patient earlier, but I also know she's room 104, and it says that on the door, so I'm good for that. The amount is this entire bottle, and expiry is September 16th, 2025, so we're good for that. And reason is because she hasn't had a bowel movement for 4 days, and as we can see here in the order and bowel protocol, it's this is what she gets after 4 days with no bowel movement. We've done some education about increasing fiber and fluid intake as well as mobility to try and change that up so she's not getting regular laxatives but rather being proactive with this. So going over the drug card for Fleet Enema. Fleet Enema is sodium phosphate. The dosage is supposed to be 1 bottle Fleet Enema, which we have here, 133 mils, and so 135 mils is according to the drug card. It's per rectum, and she can have it once in a 24-hour period. The action, it's a saline laxative that produces an osmotic effect in the small intestine by drawing water into the intestinal lumen. Onset is 5 to 10 minutes, and approximately, and it'll peak with effect. Adverse reaction, she can get a headache, she can have abdominal cramping, nausea, vomiting, diarrhea, bloating, and flatulence. And long-term use of this can cause dependence. Drug interactions with a fleet enema can be with ACE inhibitors, angiotensin receptor blockers, diuretics, lithium, and NSAIDs. It actually might affect her electrolyte levels, and so especially with a geriatric patient, we really want to monitor a patient carefully with their electrolytes. Effects on the lab test results, it might actually increase the sodium phosphate levels, so may decrease electrolyte levels with prolonged use. Contraindications, do not use in patients with sodium restricted diets or intestinal obstruction, intestinal perforation, edema, heart failure, negative colon, impaired renal function, or with the signs and symptoms of appendicitis or acute surgical abdomen. We've already assessed that my patient has no nausea and vomiting and she has no abdominal pain. Use caution in clients with hemorrhoids or anal abrasions, which we will look at when we go to administer. And if she did have an overdose, signs and symptoms would be a severe electrolyte disturbance. She would get possibly dehydration, hypovolemia, cardiac arrhythmia, multi-organ failure, death, or QT interval prolongation. So that is the drug card for fleet enema. So doing my second check now for fleet enema, it's sodium phosphate. It's for Susie Wong and Susie Wong. The expiry is September 16th, 2025. The reason is because she has constipation. She hasn't had a bowel movement in 4 days. And so, according to bowel protocol, she gets sodium phosphate fleet enema every 4 days. The route is rectal, and the time is PRN, so we know to give it in the morning like this on the 20th at 8 a.m. And we've already educated her a little bit about it. We'll talk to her a little bit more about the actual drug when we go in there, and then we'll also do that evaluation afterwards. And the documentation, we have the order here, so we have that. We're going to dot the MAR here now before we take it into the room, and then we'll further document when we come out about the results and what drug we used. Okay. So now just before I go into the room, I'm going to do a final check of this medication. So this is sodium phosphate, and sodium phosphate is what we want. Susie Wong is my patient, and the reason is because she's constipated. We know that she's 4 days with no bowel movement, and according to the orders, 4 days with no bowel movement means that we're giving sodium phosphate fleet enema. The route is going to be per rectal, and this is a rectal solution. The time is it's a PRN, but we know we want to give it in the morning and we want to give it right now. The amount is going to be this full amount, and according to the drug card, that's accurate, 133 mils. And I think we're ready to go in and see our patient now. So I'm going to take an extra lubricant with me. I've got my hydrocortisone and I've got my fleet enema. Oh, I know, I want to dot my MAR for the sodium phosphate fleet enema for the 20th. And then I'll sign once I administer it. Okay, so going into the room now. Hi, Susie. I'm back in here to give you your medication. Are you doing okay? I'm gonna make sure the door is closed. Obviously, I don't want to, I want to make sure my patient has privacy. So I've got your medication here, Susie. Oopsie, got your medication here. And I'm gonna go wash my hands and get a couple more supplies, and then I'll come back and administer your medication. Do you have any questions? No? Okay, a couple other things I'd like to do maybe is get some of the supplies and equipment ready for you. Okay, do you have non-slip socks on right now? Oh, you do, great. And also, what about hearing aids? I didn't see on your ADL that you needed them, but you're okay? And glasses, you're okay? Okay, excellent. So I'm just gonna go ahead and wash my hands and I'll be right back. Okay, Susie, so the first thing I want to do is put your ointment onto your hands. Do you have any concerns about your hands? Not eczema? You had eczema a long time? Yeah, seems to be the case. Okay. So I'm gonna go ahead and administer the eczema. Lift your bed up a little bit so I can reach together. Okay, so just putting a light layer on as per the protocol. There you go. I'm gonna instruct you not to touch your eyes, okay, Susie? Okay. So Susie, next we're going to do the enema. Have you had an enema before, did you say? Yes? Okay, so it might be a little bit uncomfortable. You might feel like a fullness, maybe some pressure. If it gets to be too much discomfort, I want you to let me know and I can stop. But I'd really like you to just kind of take a deep breath as it goes in and try and push through it. It won't last very long, and then afterwards, of course, you'll be able to have that release that you need. So I'm going to get you to roll up into what we call the Sims position, which is up on your left. I'm going to get you to grab that bar, and I'm going to get you to move your right leg bent up, so that I have access to your rectum. And I'm going to put this cloth under you, and I'm going to administer that enema. I'm just gonna say out loud to anybody that's interested is this should not take very long at all, and then we will be done. So if you could just hold on for a couple more minutes, we're almost there. And then that way we won't have to start from scratch. Sound good? And you just hold your position for a couple more minutes. Thank you, Susie. Okay. I'm going to get you to roll up. That's right. Take a bit down. Okay, so get you to roll up, Susie. And you can go ahead and grab that bar. Excellent. Excellent. And right leg up. Very good. Thank you. Okay. So as you can see, I've got a good visual here for Susie's anus, which I need. I'm going to lay down my waterproof pad. I normally wouldn't have this basin here, but because I'm not wanting to soak the bed and the mannequin, I'm putting that there. So I'm going to get my enema out now. I've got sodium phosphate, rectal solution. I've taken it out of Susie Wong's cart, and I've checked that this is Susie Wong. And I know that my expiry is September 15th. I know that she has not had a bowel movement for 4 days. So all my checks have been done several times. Now this is a pre-lubricated medication, but I'm going to add lubrication just for patient comfort. Okay, so Susie, what I'm going to do right now is just check your anus for any hemorrhoids or fissures, and I don't see anything at all. So now I'm going to insert the fleet enema into your rectum, and I want you to take a deep breath as I insert it. I'm going to be inserting about 7 to 12 centimeters and towards the umbilicus. So this is Susie's anus, and I am going to be going towards there. Excellent. And then in one, there we go. Take a deep breath, Susie. Are you doing okay? Okay. So it's important that I don't stop administering the enema. Almost done, Susie. Just about there. Just putting the last little bit in. There we go. Okay, I'm withdrawing it. I'll get you to stay in that position, please. Okay. Taking the enema out now. Very good. Okay. And we can dispose of that. A little wipe here. Very good. I'm going to get you to maintain that position. Okay, this bedpan isn't actually here, so I'm just going to move it to the side. Okay, Susie, I'm just going to cover you up a little bit. I'm going to give you the call bell, and I'll let that work, and then we'll come back and get you to the toilet. Does that sound okay? All right. You doing okay there? Okay, I'm just putting the bed down. Now I'm going to put the rest of the bed down. There you go. Okay, so you've got your call bell. I'm going to go ahead and document my medication. And I should wash my hands actually again. Administered hydrocortisone, so I'm going to sign my MAR here, and then I've also administered the sodium phosphate, so I'm going to sign my MAR there. I can discard of this and this now. Now I would like to document my response. I'll be sending that to my instructor, but I actually need to get Susie to the bathroom first and see what her bowel movement looks like before I document, so I'll do that on the second video. So at this point, I'm just waiting for Susie to call, and then I will transfer her to the bedpan, or to the commode, I mean. So we'll have them in the next video. Thank you.